Ma'am, we are live.
Yeah. So are we ready to start now? Have people started joining in?
Yes, ma'am, we have
Yeah.
around 120
Yes.
people joining. Yeah.
Yes. So as soon as we start seeing everybody saying hello, because sometimes they miss the beginning of the session
Yes, ma'am.
as they are still joining in. We usually come to know when Rupali Tanna puts the first message. Today we have Malti Paliwal, who is the first one to put in a message for the webinar. And I think now we are good to go because Rupali Tanna has joined. Very nice. So namaskar and a very good evening to everybody who has joined us on this very essential webinar, which is going to be discussing the safety guidelines before we reopen early childhood centers. Now, when we talk about early childhood centers, we are actually talking about all kinds of early childhood centers. We're not just talking about the private preschools. We're talking about daycares, we're talking about anganwadis, we're talking about balwadis, we're talking about any place that takes care of children in the early years. Care and education is basically a very important component of the early years, and daycares usually take care of the care aspect, and creches, daycares, all these take care of the care aspect, and the preschools, balwadis, anganwadis take care of both the care and the education aspect. Now, of course, all of us adults have understood how difficult COVID and Corona have proved for all of us. So you can imagine how they have been for our littlest citizens. And whenever we open up for the corporates, the workers, everybody, child care and education is going to become extremely essential. So daycares and preschools will, of course, be in a haste to open. But I would like to caution everybody, please do not open till the government does not give you the permission to open. We are taking care of the littlest citizens of this country, and it is our duty and responsibility to ensure that they are absolutely safe. Early Childhood Association has come out with these guidelines so that if you are preparing to open, you are in a green zone and waiting for that green flag from the government or from your city head to help you open your preschool, you must go through these guidelines. We've divided these guidelines into 4 sections: what to do to prepare the center, what to do to prepare the teachers, what to do to prepare the parents, and the last section is what to do to prepare the children. We've also included signages that you will have to have all across your school because, friends, this is a new normal. And children are going to take the longest time to understand things like social distancing. And that's why we've tried to change the name to physical distancing, because it's not socially that we want people to be distant, but we want them to understand physical distancing. So a lot of these kind of things have been included in the guidelines, and our earnest appeal to every person who runs a preschool, who is a teacher, who's an educator, who's running a daycare, who works in a government balwadi or an anganwadi or a creche, to please don't undermine the safety of children in your rush to open up things for children. It is very important that the stakeholders are all together and ensure a safe return for the children. It's going to be very different. Children will have to be wearing masks, maintaining physical distancing. They will have to sit away from each other, and think about it. We are talking about 3 to 6 year olds, how difficult this whole process is going to be. So for us to be successful, it is important that first we mentally, emotionally imbibe these new rules so that we will be more patient, more understanding, and more supportive to the children when our centers do open. We are extremely proud and honored that today we have with us Ms.Sunisha Ahuja, who is the education specialist for ECE, Early Childhood Education, from UNICEF India. We are extremely fortunate that she's here to not only give us a keynote address on this very important topic, and she will be joining us in the panel. The panel will be discussing the guidelines for COVID safety before reopening early childhood centers. So welcome, Ms. Sunisha, and thank you on behalf of the entire education community for being with us on the webinar today. Over to you for your keynote address.
Uh, Thank you so much, Dr. Swati, and good evening to all those more than 350 people who have joined this webinar today, which also tells me how we have this large community of people in our country who are concerned about the youngest citizens of this country, who are concerned about, as responsible people running preschools, as to what their roles and responsibilities will be in this new normal that we will all be living in or are already living in. I would like to share some thoughts with you as part of this keynote address. And these thoughts are informed by some of the readings that I have been doing, reading public health experts, reading ECE experts, and some of the guidance that UNICEF has put together, which has been one of the reference documents that has been referred to in putting these really valuable guidelines. I'm really impressed with the kind of detail that these guidelines have for all of you here. And I'm happy to be, part of this ongoing conversations as you move ahead. We are at the end of this call. I will also share with you that one of our regions, the European and Central Asia region, has come up with recent detailed guidelines on opening of preschools. I would be happy to share those as well with you. You may want to look at those guidelines if there is something that suits our environment, could be looked at. There are several other resources that UNICEF has put together, both in terms of reaching out to parents and providing parenting tips, which are now available in English, Hindi, Marathi, Assamese. We would be happy to share these set of 12 posters with you. These have come out of a massive piece of research work done at the University of Oxford, supported by UNICEF, USAID, WHO. And I think it has some really valuable information given the kind of spectrum that you're talking about covering in this call, both children going to government Anganwadis or Balwadis to private preschools. So I would be happy to share those resources and be part of this conversation. In order to kind of set the ball rolling on this webinar, I think the question that's topmost in all of our minds, and both as people who run programs for young children, but are also parents of young children, is it safe to open schools for children? And that's one question that is right on top of our minds. And will there be ever no risk? I think what we need to remember is that from now on, there will always be a risk. And we will have to look at our solutions from the lens of how do we reduce or minimize risk. And therefore, our solutions will have to come from there. As a parent, I think the questions that are uppermost in minds of most parents are, what are the risks in the schools that my child will be attending? How could this affect my child's health? The status of local testing, tracing, monitoring systems, are there enough of those available? And would I be able to kind of have a reach to these, services in case required? So as part of this conversation, I just wanted to kind of, talk from there. So coming back to this question of how do we reduce risks for children through the schools that we are running, the answer to this actually lies in the data. And unfortunately, we right now don't have much data in terms of what is the possibility of children getting this infection, what are the possibilities of children infecting teachers or children infecting parents. These are things that haven't really come out in while Lancet has actually reported this year in these last 2 months, maximum number of papers have been submitted to Lancet. Lancet has never received so much of research submitted in such a short period of time to look at various aspects of the virus and its effect on people's lives. So that's one of the other things. I think schools should open up, but then there has to be a larger preparation. So while the schools make a preparation for themselves, the larger system also has to be prepared in terms of the three things which are very, very critical, which is test, trace, isolate, and monitor. I think these would be very, very critical, and perhaps these are the things that will inform the government's decision in terms of taking this call on when schools will be opened up. So that's one of the things that I wanted to place here. The other question, like I said earlier, the other uncertainty that is around is this question about we don't have sufficient information about the degree to which children can transmit the virus. And I think that is somewhere we need more information. We need to know more about this. For example, in a paper submitted to Lancet in Lombardy in Italy, which had a huge, outbreak, apparently children had a 30 times increase in children getting the inflammation after that. After the kind of the peak happened in Lombardy. Now, so there is some data that has come out of this paper. So I think the public health experts, doctors, researchers are still trying to figure out, the impact of the virus on children. Coming back to the point about opening of schools, I was looking at the global scenario, and countries like Denmark, Norway, Germany, and New Zealand have taken decisions to reopen schools. They had completely shut down all schools in their countries, but these are the countries that are probably the first kind of responders in terms of opening schools. There is a study that I'm still kind of reading, so I'm just sharing very preliminary findings from that. This is a study done in New South Wales, Australia, where they found that children when they were in school, it resulted in very little in terms of transmission of the virus. However, in the context was that the school attendances during this study were very low, and therefore schools were able to maintain the physical distancing. And perhaps that is why the transmission of the virus did not happen as much. So the physical distance, what also therefore is important to learn from this study is that the physical distancing piece is something that we will really have to work towards in terms of teachers, parents, and then all of these adults actually supporting children in terms of understanding this practice of physical distancing, because young children would tend to kind of come and hug each other, play with each other, and how do you kind of keep them at a distance of say 1 meter or 6 feet, whatever it may be. Now countries are taking decisions of reopening schools based on their own socio-political situations. Some countries are deciding that they will open schools for the older age groups, so children in secondary and senior secondary classes, class 9, 10, 11, 12, because it's easier to manage with them, and therefore, to establish certain norms in schools perhaps would be easier. On the other hand, countries like Israel, New Zealand have taken a decision to actually bring the younger kids back to school first, children from the most vulnerable communities first, because that's where they feel that children need the most support. In fact, one of the other things that is coming out, which is really alarming, is children are facing a lot more violence in their home environments. Children are there are families where perhaps that one meal that the child, 1 or 2 meals that the child got at a preschool or a daycare center, the child is even missing out on those meals. There is domestic violence that has gone up. Of course, with a lot of schools also promoting online teaching, children are facing a lot of online abuse. So there is enough evidence that is now there that children are actually living in very difficult circumstances at home. It is a stressful situation. Parents are stressful. There's a lot of uncertainty. And in many situations, we're also realizing parents don't really know how to spend time with their children, how to keep their children engaged. They've actually become the first responders, but that's also been a challenge because they are not trained or they don't know really what is it that they exactly need to do with their children when children are around the house for 24 hours. I was on another webinar and somebody made a very interesting point. Because children are not really getting any physical activity during the day, they're in confined spaces sometimes. They're not sleeping enough. So their days have become longer. So that's another issue. And that has implications for that when we open up schools, how do we plan for doing this? So coming back to this point about, younger kids first or older kids first, I think these are some things perhaps which may come out of government orders, which may be suggested through SOPs that the Ministry of Human Resource Development may come out with, or the Ministry of Women and Child. My understanding is that in the Anganwadi centers, the preschools may perhaps be the last service that will become operational, because there are concerns that there is no immunization happening for children right now. So children are missing out on very critical immunization dosage. There isn't enough monitoring of children who are severely or moderately malnourished, and that needs to be addressed urgently. Women who are pregnant, who are breastfeeding, they need advice that in case a mother is COVID positive, then does it have an implication on her pregnancy? If she's COVID positive, then how does she feed her baby? And I think these are the kind of pieces of services. Those are the services that perhaps are likely to get started first, while the midday meal, the take-home ration is continuing to happen. So the ECE service, the ECCE service is perhaps going to be the last. And we know, there are several panelists who will also actually focus on that area. I think what this situation has also kind of thrown up for all of us is moving forward, we'll actually have to kind of build out the whole work that we have been doing with parents. And as UNICEF, that's one area that we are really looking at in terms of moving ahead. How do we work with parents? How do we reach information to parents, be it through the Anganwadi workers, through IVR calls, through WhatsApp messages? A lot of that work is currently happening in different states, Maharashtra, UP, Rajasthan, Odisha, Assam. A lot of that work is happening, and I'd be happy to share the resources that UNICEF has created. But I'd like to kind of place this here to all of you. I think moving forward, one of the important pieces that we'll have to now think of as we move towards opening schools, that this decision of how schools will be run, what will need to happen in schools, will have to be now a joint decision by public health experts, child development experts, education experts, infection control and clinical health experts. I think we'll need to bring a community of such people together, because each one will bring onto the table. Some know how children respond at that age. Others know how the virus responds with human beings. I think it will have to be a collective decision made by all of these stakeholders moving forward. Thank you so much. And since I'll be part of the panelists, I'll be happy to answer questions later as we move forward. Thank you, Dr. Swati.
Thank you, Sunisha ma'am. That was, I feel, a very, very important keynote, because you touched so many aspects which I'm sure many educators and parents have not thought about also. First of all, I would like to thank you for appreciating the guidelines. I would also like to share with you a good news that we've just got our Marathi translation done today. So we are trying to translate it in at least 4 different languages so that it reaches out to as many states and teachers and educators as possible. We would love for you to share the documents that you spoke about so that we can then share it further in our community. ECA today is a 42,000 members strong community. We have 48 territories where we have territory heads who have their own committees and they work. And that's why for us to reach out to the different parts of India is quite easy. And we would like documents like this to reach every part, every corner of this country, so that the teachers, educators, and parents are the ones that benefit from the same. You very rightly said that will there never be a risk? And this is something that we all need to understand, that WHO has also said that we will have to learn to live with this virus. A vaccine has still not come out. We don't know when it's going to come out. And if we want to start our normal life, we will have to understand the risks involved and work towards ensuring that we don't increase those risks, especially when it comes to children. Status of testing, so rightly said that test, trace, isolate, and monitor. And that is something that I appeal to all governments, that they should get this in place before the schools are started, because this is going to become so much more important. You very rightly said that it's the socio-political decisions which are actually making countries choose differently in which age groups to start with and which age groups to start last with. And you are right that in India, the ECE services will be the last to start, because we are struggling with so many other issues which need to be focused on even more right now. And your last point absolutely tells us to revisit the quotation once again, that it takes a village to raise a child. And it's going to take a very, very big village of public health officials, infection experts, government experts, child development experts, pediatricians. Everybody will have to come on board so that our children are safe in the schools. Thank you very much, ma'am. And thank you for joining us in the panel also. I would now like to take this opportunity to introduce our other panelists. I would request them to please switch on their videos. Thank you so much. And I'm going to do the introductions in a very different way. I will be giving the ECA part of the introduction, and I will leave your personal introduction to you, so that if you want to add any one more designation also, that can be possible. So I'm going to start with Dr. Reeta Sonawat. Everybody knows her. She's our executive director of both ECA and APER. APER is our new association called Association for Primary Education and Research. Dr. Reeta Sonawat is the former dean of SNDT Women's University. Ma'am, would you also like to add anything more?
Thank you, Swati. Thank you very much. Right now, I'm working with the Ampersand group also as a director early childhood education. So that will be also helping me to work with the Balwadis and Anganwadis. So
absolutely,
that is close to my heart. So that's the reason I accepted to work there.
Welcome, ma'am, to the panel. Our next panelist is Dr. Kamini Rege. Dr. Kamini Rege, like Dr. Reeta Sonawat, is also one of our founder members of the National Committee of ECA and APER. And presently, she has a very important role, that of a treasurer. Dr. Kamini Rege is Assistant Professor, Department of Human Development, College of Home Science, Nirmala Niketan. Welcome, Dr. Kamini.
Thank you, Swati. Thank you very much.
Would you like to add anything to it?
No, thank you. You've said all of it. Thank you.
Thank you so much. We now move on to our next panelist. Our panelist is from the private preschool sector, because we've tried to have people representation from both the private and the government sector today. So Ms. Divya Punjabi, I love her title. She's the culture custodian of Cambridge Education, and she's also the vice president of the Early Childhood Association. Welcome, Divya. Would you like to add anything to your designation?
Good evening. Thank you. You added both my titles. Thank you so much, Swati.
Thank you so much. And our next panelist is from the government Balwadi sector. She is the lovely Ms. Poonam Lalvani. She is the managing trustee of the Life Foundation, Life Trust NGO. And she looks after hundreds of Balwadis in Mumbai and I believe in Pune also, Ms. Poonam. Mic. Switch on your mic. That's right.
Thank you, Swati. No, we are not in Pune as yet, but one little correction, we are the Life Foundation, not the Life Trust anymore.
Okay. Life Foundation, yes.
Yes. So, yes, we are working with the Balwadis and the MCGM schools and the Anganwadis in Bombay.
Okay, that's wonderful. We are very happy to partner with you because we help you train the Anganwadi and Balwadi teachers.
Yes.
And ECA has started this is the last 2 years. And every year we ensure that they undergo the 1-year teacher training program so that they are all qualified and they understand what is developmentally appropriate practice. And it's a pleasure and honor to always support the work that you do.
Thank you so much.
Starting the panel discussion, we also have Ms. Ahuja from UNICEF, who's also part of the panel. So I'm going to start the panel discussion with Dr. Reeta Sonawat. Ma'am, why do you think it is important for preschools and daycares to follow these guidelines that the Early Childhood Association has issued? And mic. That's right.
Yeah. Thank you so much, Swati, for this question. I can see here the parents are emotionally and mentally affected. And they are also scared. And a lot of stress they have about the children. And we don't have really data supporting that children, they should be going to the school or not. So these guidelines will give them confidence that parents, when they read the guidelines, they'll understand how the school is ready to take care of their children. So so parents' worry will go. And once parents' worry will go, these guidelines will help even the teachers, because teachers will have clear-cut rules with them, what to do, how to do, and when to do. All these things are mentioned in the guidelines. So teachers will also be confidently coming and taking care of the children. And thirdly, I like to say, even policymakers should also be reading these guidelines, because for them to take a decision that school should be open, from where the school should be open, how school should, and children, especially the vulnerable children, when we are talking about Israel and New Zealand, their countries, vulnerable children, and the institution where they go, the condition of the institution is very different than the country, India, where our children, those who are going to the Balwadi and Anganwadi. So we need, when we are talking about all these things which is written in the paper, we need to understand very clearly. And these guidelines are giving a very good direction to the policymakers also, that if school is ready to follow all these things, so what should be the decision? So taking decision will also be easy to the minister if these guidelines reach to them. So that is there.
Right.
Second point is the school, if these guidelines are not there, then definitely reduction, guidelines are helping reduction in risk. We have less data, that is agreeable. But if schools start maybe in the green zone, but still those zones also, these guidelines will help them to further reduction of the risks and prevention. So children, that is clear that children, it's very difficult to limit children, but simultaneously this is also very clear that if the boundaries are given to the children very clear cut, then children, they follow the boundaries. And we have a lot of data from this sector where the if limits are defined to the child take care of the limits very well. So maybe that data can support us later on through these guidelines. If the school is started, then these guidelines will work as a prevention to the school. And lastly, I will say it will give them the clarity to help the school to run in a very smooth way. So guidelines are giving rationale to the teacher, helper, and administrator. If they have started the school, they are starting school taking care of all these preventive measures. So that's the reason I personally feel guidelines are helping a lot.
Thank you, Dr. Sonawat. I think that was exactly the reason when we discussed this in the National Committee, that many people thought that it's too soon to come out with guidelines. And we said, no, we need to give enough time for the schools to understand what is now expected of them where safety is concerned, so that it gives them enough time to train the staff and also to appraise the parents about the kind of safety measures which would now be taken. So you're absolutely right. It gives them a boundary within which to work. Because many people think that when the city is announced as a green zone, yay, Corona gaya. It is not like that. Green zone means your number of cases have now reduced enough for you to start coming out. But Corona is still there. COVID is still there. So it's very, very important for anybody listening to this to understand that, as said in the keynote address, we have not yet overcome the complete disease. It is only the risk which may have been lessened now. And that's why we say it's a green zone or an orange zone. So it is very, very important. I don't know what a green zone looks like, because we are sitting right now in a very red zone. So let's just hope and pray that some sense prevails on the people and we turn at least towards an orange zone now. Coming to you, Kamini ma'am, you have always supported parent-school partnerships. I would call you the mother in parent-school partnerships. Like I would call Dr. Sonawat the mother of metacognition. So I would like to ask you, as you are aware, we've sent this to all parent communities also. Yes. Each of the parent community heads that we sent it to have over 2 lakh members. So we have ensured that this also reaches as many parents as possible. The reason behind this was that we wanted parents to understand what to expect from their preschools before these preschools or daycares open. Tell me, there is a section for parents and children in these guidelines. So how do you think should ECA and schools educate the parents about these guidelines concerning the expectation that the schools now have from parents to support the safety of children?
Okay. Thank you, Swati. I have quick 5 points, which I'm going to emphasize on. First of all, I would want to not only use the term parents, I want to use the term family here, or because we have multiple kind of compositions of families today, whether it is single parent, with grandparents, with with aunties, uncles, joint families. Right. And right now, probably, sometimes they're not even living with parents. Some children are not living with parents because of this pandemic. So yes, I would say every family member actually right now is undergoing a unlearning and learning process in terms of every day is a change, and every day is filled with some form of anxiety and fear, and everybody's thriving through it. So obviously the context of sending the child to the school in this pandemic is going to be a worrisome concern.
I think Kamini's connection has got disrupted. I think so.
Is it better now? Is it
yeah,
better?
yeah, it's better now.
Is it better now? Is it better?
Yeah.
Yeah. So I don't know what all you have missed, but I said now that we are looking at ECA and parents and schools to kind of collaboratively come together and think about this this next step, whenever we start or whenever we have to opt into a school setup or want to go into the school, I think very, very important is the parents' readiness. We've been talking about child's readiness to go to school. I think it is important to look at the parent readiness right now as to whether they are comfortable to send their child to the school or no. That's first thing. And keeping that in mind, whether they are really positive about the school, because it is important for a parent to talk to the child positively about the school, for the child to feel that I am going to go to a safe place. So it is the parent's anxiety which needs to first be taken care of, or probably this will be taken care by strengthening the communication and coordination between the school and the parents. So obviously there should be some kind of training program, some kind of open to training ideas have to be there. Parents have to learn, they have to have certain specific parenting skills for dealing with the post COVID period. Also, some parents can become good resource people or volunteer as for benefit of their children as well as the children around. And lastly, I feel that it is important that parents need not right now in this situation need not focus on the academic achievement of the child, but rather they should emphasize and focus on the safety of the child by helping or providing them with information about simple things like protecting themselves with hand washing, hygiene practices, disinfectants, sanitizers, because children are right now being exposed to these kind of things which they were never being exposed to. So they have to prepare the child, they have to monitor the child's health on a daily basis, not something like when. And also very important it is to talk to the child, let the child express and communicate and coordinate positively with the school is what my suggestions are, which are a part of the guidelines very much. I think that is how we are going to help parents, and schools are going to be benefiting from this kind of collaboration.
Absolutely. I love the word that you came up with, parent readiness. That is going to be so important for us to work on. We have to forget about reading readiness, writing readiness, and number readiness now for at least another 18 months. We will have to focus on
I can give you one word.
Yeah.
I can give you one word saying that safeguarding readiness, parental safeguarding readiness.
Yeah. Safeguarding is again something that we'll have to explain to the parents and to many of these educators also, so-called educators. So I think parent and child readiness for opening of schools is something that we will have to focus on. A question that always private school owners and educators keep popping up is how do we resolve this headlock that private schools and parents are presently in. And I and ECA both strongly urge private schools. It is a time right now to get the trust between schools and parents. It is not the time to fight battles. And the best way that you can communicate this to parents is in you, because you would have built a relationship with these parents. You don't want parents to come with a suspicious mind back to school. It's not going to be healthy for the child, and it's not going to be healthy for you. So since we are on the topic of private schools, I would like to go to Divya, who is our representative today, not only of Kangaroo Kids, but all private schools. So Divya, my question to you, can you share with us your views about the guidelines?
So Swati, when I went through the guidelines, what I found, it's one of the most comprehensive documents I would have ever seen. Right, going from generic to specific, where, even explaining what COVID is, what are the risks, what has to be done. And as you rightly said, it's taking you through all the stakeholders, right from the physical environment also. And also there have been actionables given what to do 1 week prior to opening, and how do you handle the teaching staff, the non-teaching staff, the parents. If you just follow this step by step, you cannot go wrong at all. Also, the specific things, what I liked about is the detailing that has gone in. One thing which I really loved was having the security coordinator at the center, who is responsible for the safety and security of the children. Also, every aspect has been taken care of. Like if a school is going in for transport, what is the protocol? Keeping in mind the variables of the location, whether the center is in a green zone, orange zone. Also, the permutation combinations have been suggested. So either a school can open in a staggered way, or you can have shifts, or you can look at having, just 30% children coming on different days. Simple things of how a thermometer is to be used. Emphasis on not only the teaching staff, but also the non-teaching staff. Granular details, which probably, we would have forgotten, is to look into the AMC contracts. These are small things that schools would tend to miss out. Keeping a safe place for courier thing, having a separate area for drop up and pick up so that you have staggered timings. Separate instruction for daycares. So what has happened is we've covered the entire gamut of preschool facilities. Bedding cannot be shared, how equipment needs to be sterilized, focus to be given on disinfecting materials, do not compromise on sanitizing the centers, training to be done prior, do a risk assessment. Also going in line with what the government has recommended, Arogya Setu app to be given. The other very interesting thing, what I liked about the guidelines is there has been a aspect of even mental health, not only the children, teachers, and relaxation has been emphasized for teachers. Also, I like the 3 strategies that has been given to teachers about listen, comfort, and reassure. The most beautiful sentence that I liked was, even if you're wearing a mask where your emotions might get masked, learn to pick up the body language of children. They are non-verbal cues. How to use puppet shows, how to use placards, how to use posters to drive home the message. Also, I think since it is preschool where holding and comforting children is a key, because there would be some of them who would be a little unsettled. Steps how to take care of yourself for teachers is given. They're wearing a long shirt, making sure you're cleaning your areas which are coming in touch with children. Then you've come to parents. I think in the document, prior preparation, as Dr. Rege said, readiness by parents. Very, very clear how the communication should be done. Forms have been suggested, self-declaration. I mean, we are asking schools to indemnify themselves, but morally we know we are equally responsible for the safety and security of the children. Myths and misconceptions have been clarified. Parents have been educated how to pick up the different behavior patterns that children may have. Then we have guidelines once you open school, how to handle even the conversation when you're checking the child's temperature so that the child is not stressed as to what is happening every day. 5 basic steps, the high 5, I just love that. Very, very cute and very age appropriate about the hand, elbow, face, space, and home. At the end, the 20 actionable points which have been paraphrased, absolutely a clear checklist as to what has to be done. Then focus has also been given to education, that please ensure you continue the blended learning, be prepared for the second wave, which may happen, and also not to focus on assessment. So I think it's the very, very comprehensive document.
Thank you, Divya. I think we need a blog from you on this, because I saw while you were talking about all these guidelines, there were more comments on where can I get the guidelines? Where can I get the guidelines?
I'll do it.
All of you who are listening to us, the guidelines are freely available on the Early Childhood Association website. I request Mansi to type in the website address so people can get it from there. Presently, we've given a lot of signages and posters on hygiene and safety at the back of the document in 6 different languages. So it's in English, Marathi, English, Hindi, English, Gujarati, English, Tamil, English, Telugu, English, Kannada. We are trying to also get them done in Bengali. So very soon they will be available in English, Bengali also. Having heard so much detailing about the guidelines, my next question goes to Poonam. And my question to you is, how much of these guidelines do you think you will be able to implement in the Balwadis under you?
First of all, I have to congratulate the ECA for the most brilliant piece of SOPs that I have seen. It is so detailed and so comprehensive. I don't think any school can go wrong if they just follow that. Sure, on the ground, there may be things that they need to quickly adapt to. Where these guidelines go in terms of the Balwadi, just to give you a brief, we run the English medium Balwadis for the Municipal Corporation of Mumbai. We run 92 of them in all their NPS schools, which is Mumbai Public Schools. Now, our MOU with the MCGM is that they provide us the infrastructure, which is the classrooms, the toilets, and we run the classes. So our teachers, the equipment, the games, the toys, the books, we do all of that. Now, where, you know, the security, if it means a thermometer, if it means the sanitizer, all of those we will put into place. We have certain different challenges, and to me, that's the most important, is the hygiene. And that is my regular tussle with the MCGM, that, you know, the toilets need to be clean, and you know, the classrooms need to be clean, and the IABIs need to come and do it, because that's their part of the partnership. And that's where the struggle is, and a challenge to me. Now, the fact that you've come out with a Marathi one, congratulations, and that makes me really happy that I will be able to share this across to all our parent groups through our teachers. In this time, we have kept the communication going. Our teachers have these WhatsApp groups, and they have been communicating with the parents and finding out what the kids are doing. We were trying to engage them with some games and quiz and some dance moves. But from what I get from the MCGM, I just spoke to them a couple of days back, they are very unclear about when and if the schools will start before September, because these schools have, all our schools have been converted into quarantine zones. So
Yeah.
I really don't know how they're going to get back to school. However, we definitely want to start in the first week of June, some kind of interaction with the kids directly, and whether it's online. There are, again, restrictions on data usage because they can't afford it. Then, you know, how much time will the parents sit with the kid? If you know, we can send out videos, but then we have to make sure, have they really used them? Have they imbibed it? So there are a lot of things we are dealing with, and I'm sure, you know, these are challenging times. We have to think out of the box, and we'll come out with some fabulous solutions. And our relationship with ECA has taught us so much, taught my teachers so much. And we are really, really blessed to have this relationship, because they are thinking, you know, they've gone up in life. They are now qualified ECA teachers because they've got certification from you. And that's been a very empowering exercise for our relationship and for the Life Foundation to really upgrade the level of teaching in our classrooms, because and we've got excellent feedbacks both from the parents, from the headmasters, and the management of the schools, that they're very happy that these Balwadis have never, what you may say, managed the kids so well and had so many activities. And so taking that forward, I'm sure you, all of you educators today on the panel, will put on their thinking hats and come out and give us some fabulous solutions, so that we may really reach out to those vulnerable children who need the education the most. Thank you.
Poonam, one thing we can guarantee you that ECA will support you both in monetary way, if we have to donate certain things to the Balwadis, and also
Thank
in
you.
training your teachers and speaking to your parents. I sincerely hope we can also support you from June onwards in anything that you want to do for the children. Ideal would have been if Doordarshan would have started some timing in the day for early years, where
wow.
stories and poems, etc., could have been done. We had approached them, but
Yes.
they were not ready. We are now in talks with Amazon to start something, and hopefully
wow.
we're keeping our fingers crossed, and
Okay.
let's see what happens. But I would now like to go to Ms.Sunisha. Ma'am, should associations like ECA, there are many such early childhood associations in our country, should such associations also create a checklist to ensure that schools strictly use the guidelines?
Thank you for your question. And before I go to answering your question, can I just say one thing to the point that Poonam ji also raised,
Sure.
and the resources that you were talking about? UNICEF in its partnership with Sesame Workshop India, the program Gali Gali Sim Sim in Marathi is right now being broadcast on Doordarshan in Maharashtra. The only issue is that the timings are 7:30 in the morning, which in Maharashtra it's 10:30 to 11 every day. So if this message can go through your network to schools in Maharashtra, then parents can actually get their children to watch Gali Gali Sim Sim in Marathi in Maharashtra. Doordarshan National Television is showing Gali Gali Sim Sim in Hindi at 7:30 a.m. in the morning.
Okay.
But we are also in dialogue with Doordarshan in other states, where it will be shown in Kashmiri in J&K. It will be shown in Tamil and Telugu, because the school education departments there have a dedicated television channel. So yes, some of this is already happening. Coming back to your question, I think it would be an excellent exercise that if there can be a checklist which can be shared with schools, and schools could maybe ask to do a self-assessment based on that checklist and display it in a public place, because then parents can come and read it. So it ensures transparency on behalf of the school. It is something that as an association, I'm sure ECA would be very proud of talking about, in public, that there are so many schools who now adopt and follow the guidelines and the checklists that has been offered. And at any point, if you do kind of think about doing a third party kind of a review or a monitoring, then this is a tool that should easily tell you what are the kind of things that are doable or are being followed by schools. And it will also give a good feedback on if there are some other elements of the checklist that are perhaps challenging for schools in certain contexts or in certain situations, and therefore to support those schools accordingly. I think it would be a very good idea. The other point that I just thought about sharing with you was that NCRT right now is actually preparing guidelines for MHRD on reopening of schools. So it may be a good idea that once you have kind of a final version of your guidelines based on this webinar that we are having, and perhaps if there are some things that you'd like to revisit, to share with NCRT these guidelines.
Oh, lovely.
Yeah. It kind of also goes to them. And while this webinar was just happening, I happened to cheat and look at my Twitter feed, and I just got a message saying that one of the things that MHRD is actually considering that they will open up schools for the older classes first.
Yeah.
And children from age 6 to 10, they're still not talking about the preschoolers yet. I think they're waiting for the national education policy to come out. But for the 6 to 10-year-olds, it seems schools will not open for the next 3 months.
Yeah.
So that's just right now, somebody sent me a message. So I
Yes.
just thought I'll take this opportunity to share with you. But please,
Absolutely.
those of you who are in Maharashtra, please take advantage of Gali Gali Sim Sim, which is a very well designed program, very developmentally appropriate for children, developed based on Sesame Street, is being aired on Doordarshan every day, 10:30 to 11, I think.
Thank you very much, ma'am. I love two of your points. Number one is to give this to schools as a self-assessment, which they can then display outside the center, so that parents also develop more trust and faith in the school that, yes, my child will be safe out here. And we were also internally mulling about, because we do quality audits of schools. So we thought we could even add this as an element of a quality audit if they want it done. Then ECA can get picture proofs, etc. from them and give them a certificate that says that, yes, they are COVID ready now. That would be amazing. We are also in talks with the Quality Council of India. And maybe this week we will take our talks ahead with them, because they wanted to turn this into a much more in-depth regulatory kind of a document. Right now it is just a suggestive document of guidelines given, you know. So we'll keep you updated as and when that happens, but we will definitely write to NCRT and send them a copy of this document.
I would also suggest send it to NCPCR, since NCPCR came up with those safety guidelines for standalone preschools. It might be a good idea to also share with them.
Done. We will do it as soon as possible, ma'am.
And whenever you send that out, let me know. I know somebody at the Delhi DCPCR. I would love to run it past the DCPCR for Delhi government.
So if you can send me their email, ma'am, then I'll CC you in the mail.
Certainly, I'll share those with you.
Please, ma'am, that would be so kind of you.
Yeah.
Dr. Sonawat, my next question to you is that as an executive director of ECA, how would you advise schools, if you had to give just two advice to schools to best use these guidelines?
Okay, so you have given me two advice. So do the parent orientation, and it's not like a talk. I want parent to take a round of the school and see where the school has post the posters, where they have kept the preventive material, how they are keeping the physical distancing, the places of sanitizer, tissue, soap. So all these things, let them see, take a round, and after they take round, then give the orientation on the guidelines. Because most of the parents I've seen, they don't read. So this is a way of reaching out to the parents. Second point is where school also need to really do training, where they can have teacher, helpers, bus staff, security, and for them also administrators need to think that these two places, they need to have a separate budget. One is a corona prevention budget in their financial budget, and second is for the training budget, because these training budget is very difficult for a school to keep. So keeping corona in mind, they need to keep these two budgets separately. So that is the from ECA side, I can say administrators need to think. So these guidelines administrators use, and then they can be training to all the staff members. So school need to work in a very organized manner, and once they work in an organized manner, then the culture of routine and rules and regulations will come up, and once it is ready, the school is ready. Next, my point is the school readiness. When the school is ready, then everybody can come confidently and work in the school.
Absolutely. I loved your point, ma'am, that take a parent orientation not as a lecture, but take the parents around the school to show them exactly what are the procedures which are in place, what are the things that have now been initiated. And the second point, because a lot of schools presently are struggling with fees, and they come to ECA and say, now how will we manage? So I would say that do away with your field trips for the next 2 years. Do away with your annual programs and your sports days, because that's crowd gathering. You can't do that. And use that budget for your corona safety, because you will need a budget for safeguarding your children and teachers and everybody in that school premises. And that's a very pertinent point that Dr. Sonawat has come out with, that pre-planning will include this budgeting also. So that's very, very, very important. Thank you, ma'am. Those were very, very good 2 pieces of advice that you gave. Dr. Rege, what is your advice to preschool heads about training all stakeholders to understand these guidelines?
Okay, when we are saying stakeholders, we are considering the teachers, parents, collaborators, and support staff. Now, when I'm saying collaborators, it could be canteen person, it could be bus transport person, it could be booksellers, it could be watchmen. And when we are saying support staff, specifically, I'm emphasizing on DDs, TAI, assistant, class helper, or peons, etc. So when we are looking at all of them, it is important to design or help the training to be given in some of the specific things which are new now. These are not the ones that they've been training these stakeholders. One is on physical, or we are labeling it as social distancing. So what exactly physical or social distancing means and how it needs to be done. Secondly, am I audible?
Yes, yes, yes.
Yeah, okay. Secondly, the hygiene and prevention actions which need to be taken. This needs to be trained to the stakeholders. Very, very important is simple exercises which need to be which are going to help in self relaxation, as well as deal with the psychological and mental needs of each individual. Each of the stakeholders have to be considered, and that training can help. Another one, I would say that basically a lot of people come with lots of myths and misconceptions. I think a training or a session, or probably talking to them about these, or rather working on the myths and misconceptions, are very, very important, because they are the ones which will create more problems than, or they will do more damage than otherwise. And lastly, very beautifully in the guidelines, it has been mentioned that, which is of course mentioned for moreover teachers doing it for children, but I would say for everybody to be done: listen, comfort, and reassure. These are 3 important words, I think, which is needed as a part of the training also for every stakeholder.
Absolutely. Very, very pertinent points, especially when you were talking about giving them demonstrations. When I was, after these guidelines, when I was preparing the guidelines for my centers, which is Podar Jumbo Kids, we have about 498 in this country. And the thought process that we followed was exactly this, that, we sometimes forget to be safe. We tend to forget the steps. So we thought of outlining the steps and having mock rehearsals with all staff before the children start coming in, so that each one can become the other's guide. This is the step that you forgot, or this is the step that should be in place, and get everybody so comfortable with also watching over others, because it's very important that we will have to oversee not only ourselves but others also. And that is something that I have always loved best in airline staff. If you see an air hostess, when she closes the door of the aircraft, both the air hostesses close both the doors on each side of the aircraft, and then they exchange and they go and check each other's work. I think that kind of a safety net is what we will have to bring in when we are trying to ensure that these guidelines are working with all our staff. That's very, very important. Coming to Divya. Divya, tell me, please share with us how you will be sharing and implementing these guidelines across your preschools.
So I think ECA has done a commendable job of, referring to the UNICEF, UNESCO, and the MHA documents. So what we have already done is that we have a resumption task force, actually a committee which is working on how the schools will reopen. So we've referred to these guidelines. The main team has gone through it, and then the standards have been laid down for pre-opening, during the opening, and once the school is open. Like, even minutest things that have been covered in this, like having a list of COVID hospitals which have to be near your school. After that, we have encouraged is that the schools, our partners and our own schools, they make their own center specific, because there would be, as the document has covered all the variables, they make their own standards, but adhering to these and recalibrating, keeping in mind if we've got some information of around the world how schools have opened and if they have taken some additional steps. But otherwise, this has already been shared with the main team and going forward to all our centers, because this covers all the aspects, right from equipment and everything.
Absolutely. And what we are also now going to appeal as ECA to everybody, that if anybody has added any poster, anything else that they would like everybody to know about, please send it to ECA and we will put it up in our website. Because let's understand, these safety guidelines are not something that is a copyright property of some
Absolutely.
institution.
Absolutely.
That the institution should keep it to their chest and not share.
Yeah,
Right now, the kind of situation we are in, the more we share, the more we care, the better safety will be there for all our children. So this is my ongoing appeal to everybody out there listening to us. We would love to hear from you. If you have found anything missing in the guidelines, or if you have added anything new based on your circumstances, your state, your city, we would love to hear about it, so that not only can be added in the guidelines as your input, but can also put it up in our website. A lot of people are asking where on the website. So I request Mansi, just go on the website and see whether the guidelines are still featuring there today. Sometimes, you know what it is with technology, something just disappears on a particular day. So please see whether the icon is still there of the guidelines, so that we can guide the listeners accordingly. My next question comes to Poonam. Poonam, public preschools may not have necessary infrastructure like your Balwadis for ensuring many of the safety guidelines. Any suggestions on how to sensitize parents and teachers regarding the same? Because we can't put the whole onus only on the Balwadis. There will have to be some onus on the parents and the teachers also. So what do you think that should be? Can you switch on your mic? Better.
Yes, thank you. So regarding the Balwadis, what I would say is the teachers are ours, so we can train them and we can sensitize them, because they are the key functionaries in the Balwadis, right? It's the parents. So what I would really appreciate, if we can make these small videos on the same guidelines, but if we can have someone record that and explain it, that might be easier to disseminate that information. 3-minute videos. I loved what she said about the myths and when these kind of parents, first of all, there's so much of anxiety and fear and misinformation. So if we can educate them on that and bring them on track, and give them the guidelines of how they need to manage the kids if they come to school, it might be really very useful and helpful to us if we could have these little short videos which we can send to the parents, because there are about 4,000-5,000 parents we have to send it out to.
Yes. I think that's a brilliant idea, Poonam.
Yeah, any of these guidelines, even for our teachers, I would love it if we make small little videos and little snippets, 2 minutes, 3 minutes, where you talked about the drill. I loved it, Swati, because in any restaurant, in any hotel, every morning, the manager, the restaurant manager will get all his people together, and he tells them, how he expects them to serve and behave and take orders. And this is a daily drill in any hotel, in any restaurant. So yes, you can do that in your centers. Unfortunately, our Balwadis have just one, we have just one teacher, and if the class is very big, we'll have two teachers. We don't have too much support staff that can, you know, do a counterbalance, a check and counterbalance.
Absolutely, absolutely. And, you know, this is the sensitization that we wanted the listeners
Yes.
to have, that when we think
Yes.
about preschools, we are always thinking about the upscale preschools, and we are never thinking about the 80% of our children are going and attending Balwadis and Anganwadis. And
Yes.
so rightly, you know, that it was said in Ms. Ahuja's keynote that immunizations, they are one midday meal that they were getting. They are all getting missed right now. And that is something that at the core, as educators, as human beings, we need to sensitize ourselves and think about them also, and not
Yes.
always think about the affluent private sector. It's
Right.
very important that we also do our bit, how much ever we can, for our children in our Balwadis and Anganwadis also. So this is a very pertinent point you came out with, and I can promise you ECA will come out with videos for you, definitely.
Oh,
Because
wonderful. Thank you.
all of us. It's going
That
to help
is so
all of
nice.
us.
Thank you so much. Thank
We
you.
already have a corporate member who's offered to make free videos for us. So we are going to
Oh.
take him up on that.
Oh, wonderful. Wonderful. You're very resourceful, Swati. It's wonderful.
Yeah, ECA is very resourceful.
Yes, yes. I
So-
know that. I know that. It's really
So
wonderful.
my next question goes to Ms. Sunisha. What other suggestions can UNICEF give us to ensure that safety and health of young children becomes the cornerstone for all preschools, whether public or private?
Yeah. Okay. Thank you for that question. And I think, yes, safety and protection of children should be the highest priority, you know, if we want to earn the trust of parents. And I think, you know, in terms of also from a, you know, if I'm sure ECA has also developed some safety standards. Like I mentioned earlier, NCPCR has come up, the National Commission for Protection of Children's Rights. They had come up with some guidelines on safety and protection. I think, again, you know, go back to the point that those safety and protection guidelines, the COVID guide, you know, COVID related schools reopening should be placed within those kind of,
Right.
guidelines. And again, you know, you can have a checklist, you can ask schools to do a self-assessment themselves, that do they meet those safety standards. I'm sure schools also have parent-teacher associations. Involve those parent-teacher associations to be partners in this process, so that parents themselves can check for, you know,
Yes.
you know, the environment that their children are going to come back to. So from that, I think that is one thing. There is, you know, also for early childhood education program, the Ministry of Women and Child Development at one point had developed quality standards.
Yes.
You may have already seen that document. I think one can go back and refer to it to see what is, you know, mentioned there in terms of safety, and to see if anything needs to be revised or contextualized to the current situation. That would be helpful. The other thing that I just also wanted to share here was UNESCO recently, UNESCO India office has come up with guidelines for parents of children with disabilities.
Yes.
And I think that is one group of children that will need special attention and care. I don't, you know, there would be children with different kind of abilities that are enrolled in the preschools, and perhaps, you know, to think about reaching out to those parents specifically in terms of providing them some simple guidance on what is it that they can do with children at home. Because the anxiety level of children, who are otherwise also, who may have other challenges, perhaps could be higher. Their health risks may be higher. I would also recommend that, please, you could actually circulate those guidelines. They're in the public domain. Schools could look at those guidelines to see what can be done. Also, in terms of the suggestions, I think some really valuable suggestions have come from other panelists in terms of how moving forward, even like for our own programs that we do with the Anganwadi centers, one of the things that we've now realized is, like Poonamji asked for videos, and therefore through those videos, you'll at least ensure standardized messages and there would be no dilution of the message.
Yes.
I would even suggest, if you were to be able to kind of put in a few slides, like a PowerPoint presentation on key messages that schools can provide to teachers, to support staff, to contractors, other service providers, collaborators, or parents. Just simple slides which have key messages. I think that goes a long way, because then at least you are sure that the same message is going around to all stakeholders.
Absolutely. I think those were very, very valuable inputs that you have given, ma'am. It reminds us that we have safety guidelines developed by ECA. We should now add the COVID guidelines also as part of our safety guidelines. Number two, very important to have vision key messages in the video that we prepare. And the video should not just be somebody talking again about it, because it turns out to be a lecture. Visually is what is more appealing, and people grasp it much more quickly, especially because visuals don't need much of a language to back it up. So that is why, if you see in the document also, we have created a lot of signages and posters that can be displayed all around the school, and which will make it easier for everybody to understand what is expected from them and what are the procedures to be followed. But I think this has been an extremely enriching panel because the topic itself is something that we should all be taking seriously. That what are the COVID safety guidelines that should be implemented by preschools before they open, during and after they open. Because it's very, very important for us to understand, friends, and we can't stress on that enough, that COVID has not gone away, even if you are a green city. So it's very, very important to understand that COVID is here till somebody finds out its cure. And my husband recently made a comment which really struck a chord. He said, in the last decade or more than a decade, we as human beings have focused more on developing technology and not medical technology. And that is why we are struggling with these diseases and are not able to find its, if not its cure, at least its vaccine to stop it, or something that can curb its rapid multiplication like this. And this is something, as educators, we need to focus on this comment, because it tells us that maybe our curriculum needs to be revisited, and we need to focus more on the important things for humankind, rather on focusing on things just for our luxury and our pleasure. So it's a very huge comment coming from somebody who's not in the education field, but it was expected of him because he's a writer. So the writers see a very different point of view of the world, which I think they see it more in 3D, and we see it more in 2D, because we get so focused on the things that are actually not that important. But I would like to end this.
Sorry, can I just come in for a minute, Swati?
Yes,
just two things. We've talked about all kinds of stakeholders, all different stakeholders, and I think we did refer to children in the beginning of this call. And I'm reminded of two things that I'd like to share here. In Japan, earthquakes is a very common feature. And children learn to kind of protect themselves from earthquakes very early. And why do they do it? Because as a country, they practice the protection kind of practices on a monthly basis.
Yes.
Every month, schools, communities, parents, families, they will all, there's a fixed day, I'm told, where everybody, there is like a siren that goes on as if there's an earthquake, and everybody has to follow the SOP when an earthquake comes. And that has really brought those children to be aware of these situations. The other point that I just want to make, there's been a lot of concern about that children have had a loss of learning days because schools have been closed. I think we have to also recognize the fact that while children have not been in school, they have learned a lot while they've been at home.
Oh, yes, absolutely.
And I think that therefore raises expectations of teachers. How teachers are now going to be able to actually draw on the learning that children have gone through. It could be psychosocial stress. It could be different things. They've seen videos of migrant children walking on the streets and things like that. I think it will be really important how we bring that learning into our classrooms.
Absolutely.
Thank you so much for giving me this opportunity.
Not at all, ma'am. It's an honor and a pleasure for us that you and UNICEF have supported this ongoing process of ECA trying to ensure that preschools really take this seriously, because it is not that when lockdown is over, we are all free now and we are free of COVID. It's only the lockdown that has been lifted. COVID is still here till somebody finds a cure for it. And I can't stress enough on this, because the mental state of many people is that the minute lockdown is over, oh, we'll go back to our normal life, and that's not going to happen. And we all need to understand and imbibe this new normal. Yeah. So I would like to thank all the panelists, and I would like to thank Ms. Ahuja and UNICEF for making this webinar possibility. Dr. Sonawat, thank you. Dr. Rege, Divya and Poonam. And I would like to say to all the people who are listening in and have joined in this webinar, the guidelines are available on the ECA website. They are scrolling there right on the top when you open the website, and you can download it from there. And if you are not yet a member of ECA, while you are on the website, you can also become a member. And there are different membership formats. You can read about them and decide which membership suits you the best. And if you are still confused about it, you can write to us on ECAADMN@gmail.com. And you can also ask to be added to our WhatsApp groups. We have about 48 WhatsApp groups pan India. Some cities have more than 4 WhatsApp groups because we have so many members. These WhatsApp groups are free. This is where we share all information to do with early childhood and the work of ECA and APER. So you can write to ECAADMN. So it's double A, ECAADMN@gmail.com. Please don't forget to write your name, your phone number, and your city, so that we can add you in that particular city's WhatsApp group. It's very, very important, friends, for us to understand that children are the silent sufferers of this entire pandemic. We are busy with our work even when at home, but our children are missing out on many learning and development opportunities. And it is for us as educators not to look at it as a financial gain or a financial opportunity, but to look at it as our way of doing our best for the children, because that is why we have all come into this field, to take care of children, to nurture them and to support them, especially in times like this. So this is where the ECA stands for. And I would like to end this webinar by saying to many people who have asked, is there a certificate for this webinar? No, sir. No, ma'am. There is no certificate for attending this webinar, but there definitely will be a certificate once you prove to us that your preschool, your daycare is up to the standards that are defined in our guidelines. So once you do that, write to us and we will definitely issue you a certificate. But there is no certificate for attending this webinar. It is actually this mentality that we have to get out of. We shouldn't be on a hunt to collect certificates. We should be on a hunt to collect knowledge. Knowledge is what's going to stay with us. Your certificates will perish in fire and floods, but knowledge is what is going to stay here with you. So that's the best certificate you could have got, is the chance to listen to all these experts, both from ECA and from UNICEF. So thank you for joining us. Our 2 upcoming webinars are going to be on how to deal with the anxieties that the private preschool sector is going through. This week, it's called Candid Conversation with the President of ECA. And our next webinar is going to be on how to conduct blended learning for preschool, because many preschools are making a lot of mistakes. So we are not only coming out with guidelines on blended learning, but we'll also be conducting a webinar on that soon. So keep tuned to whatever ECA is planning to do for the welfare of schools, teachers, parents, and children. Thank you, everybody. Thank you, Ms. Ahuja. And thank you to all the other panelists for joining us here today. And let's hope and pray that somebody finds the cure for COVID. Till then, it's physical distancing, hygiene, and masks, and safety for all of us.
Thank you, Dr. Swati, and thank you to all the other panelists.
Thank you.